Hi everyone, I am back. I'm Jodi Duval. I am the CEO of HOMeHOPe Australia, faculty member, helping spread the word on preventative health, cellular health, and I'm also a head naturopath and owner here at Revital Health. I love talking about all these particular topics, and I chose these topics for these videos because I get asked them a lot. I see them a lot in clinic, and for those who I mentor, really have commonly asked these types of questions or the topics that come up. So today is about period pain. Now, period pain is common, but it's not normal. So when I look at this, it doesn't mean that, when we're accepting, and meet a lot of women who accept the pain and they don't have to. And the varying degrees of ability to take pain for women and the sensitivity to pain varies. So then some women are putting up with an extreme amount of pain. How I like to look at it and tell clients and students and practitioners is that your body is telling you something that is out of balance. Like anything that we see in the body, the tips or the screams, the whispers or the screams are the ones that we really need to listen to, because they're the ones that are telling us before we even see it on pathology. Generally we see it metabolize quite quickly, and that's why HOMeHOPE does the metabolomic testing. So what we're looking at for period pain particularly is those biochemical drivers. We've got the prostaglandin causing strong uterine contractions and pain. We've also got inflammation like magnesium, and even poor estrogen clearance can make cramps worse. When we have conditions like endometriosis, this is going to be escalated even further. So these are for normal conditions or condition of the body without us knowing about anything else. But of course, if you're feeling pain and you're unsure, then having to have a look at ultrasounds, making sure that you're getting a good diagnosis and knowing what is going on there can be very empowering to then action what you need to. So we can also look at, for period pain, lifestyle and environmental drivers. Stress really elevates cortisol, and this disrupts progesterone, worsens PMS, but really it disrupts the whole cycle, So it's the link between fertility, it's the link between, cortisol. We have the HPA axis, or the HPO axis, as we talk about with women. So the environmental toxins as well, plastics, fragrances, and estrogens amplify symptoms, so that can make that a lot worse. And also, if we don't have correct your liver function to detoxify and to clear through the microbiome or the estrobolome, is also very, very important. Nutrients and hormones. So we've got magnesium that relaxes your own muscles, omega-3s. If you're lacking in, do your fatty acid panel, please. So you can lower your inflammatory prostaglandins in that way as well. And then hormonal imbalances. So looking at these, how are you going to correct those for the women that you see? So what I normally do is track symptoms. We identify timing, severity. Was it because of a stressful event? Is it every second month? Is that associated with egg release? Is that associated with anything else that goes on in their lives in those particular times? Looking at knowing what is normal throughout the cycle for your clients will make them more empowered to tell you more information. We can use targeted nutrition. We can use toxin exposure and support liver detox pathways, and it's always a good idea to clean up your environment. So practical tips. If period pain is interfering, then that is a massive red flag. With pain, we look at things. It's a monthly check-in for women. We know how their body is functioning. So with the right nutrition, hormone support, cycles can be pain-free. We just need to aim to look at that and to understand it.